Hello friends, today we'll deal something to do with menopause. So coming to our that basic first video where we discussed about 25% of our problem in our gynae OPD is related to menstruation. So in that we discussed about AUP, discussed about dysmenorrhea, we discussed about amenorrhea. Now I am discussing about menopausal problems. See again, this atypical uterine bleeding also includes all these things. Okay. Uh, AUB in adolescence, AUB in old days. That's also under AUB and DUB. No? That I'm not doing. But if you want, let me know. You can discuss about precocious puberty. Not related. I mean, related to menses. So if you want to let me know. Today in this class, we'll discuss about menopause. Fine. So what is menopause? Why definition? Importance? To classify a patient. When do you say in India, 47 years is the most common. So when you say a patient has menopause, if she didn't have menses for 12 straight months, that means, or you can write 1 year. Okay. That is one clinical definition for menopause. And also if you do biochemical panel, if FSH versus LH ratio is more than 40 milli international unit, I guess, you just let me know. Okay. That if this is a biochemical definition, biochemical definition when she is approaching the age of 45 to 50. If she is 15 or 20 and if she has something like this, that is pathologic. Correct, no? And if she is not having menstruation, that is secondary amenorrhea. Correct, no? So see, that's why age is something which is important. That is one thing which I need to talk about. It's 45 to 50. This is a clinical definition. So normally expect at 45 to 50 years. In India, it is 47 years. Prime, median value. Statistics. See, doesn't mean I know all are studying biology. Doesn't mean you have to leave mathematics. See, statistics forms a basic approach. If you know stats, you know what is the common basis. And if you know what is common, many of your MCQs you can solve. And also you will know when sitting in OPD, you will know what cases you can see. At least you can take a guess. That is okay. I cannot say that in every video. Now coming to our anat physiopatho approach. So anat same hypothalamus, pituitary, thyroid, insulin, and uterus and vagina. So here I would say, and also bones. I know, bad at drawing. It's fine. You are just okay. Bones. Okay, fine. See, major things here is about hormones. So hormones who does PRSS and physiology. Here estrogen is getting abnormal. Less. So you need to know the effect of estrogen on various systems. So what does estrogen do? Basically, I will talk about bone. I will talk about other vasomotor symptoms and other important things. So what happens is, see, estrogen is very very important for maintaining this. It inhibits osteoclast. Osteoclast destroy bones and promote osteoblast. So which increases absorption of calcium and it is important for bone development. See, I will say you one thing. See, colostrum, right? Remember like this. I know everyone knows estrogen deficient case produces this thing. Colostrum, the breast milk of first 3 days. It has what more? Calcium. Where do you think it is extracting from? From bones. So estrogen thinks what? That she might become pregnant. So for that you need to have calcium reserve. For that you need to have normal, good bone mass. See how beautiful nature is. That's why I'm saying this. Even donkey can write osteoclast, osteoblast. But if you don't know the link with nature, you're gone. Study doesn't feel interesting if you don't know why nature is doing it. So that is something which I remember. So yes, we'll come to you with the features of backache. All these things we'll discuss later. Okay. Now estrogen with vasomotor symptoms. So see, that means blood vessels. See what happens is, now estrogen is becoming less. This is what hormone. So this has something to do with even neurotransmitters. See, physiology is nothing but hormones and neurotransmitters. If you know this, half of your physiology is done. So what happens in these cases is, see, serotonin and noradrenaline, gets slightly up and down. See, no, serotonin, is a happy hormone, but noradrenaline is not. So if this levels increases, so you'll have vasomotor symptoms. What does vasomotor symptoms mean? See, vasomotor symptoms means hot flashes, all those things. That means in night, suddenly she will wake up. She feels she's hot for 5 minutes, then she'll be normal. Okay. So next one more thing. So what is the other? How do you remember that? Why do you think blood vessels? What is the connection between estrogen and blood vessel? That is the hypothalamo-pituitary axis is getting disturbed. Now something to do with what? Yes. Yeah. Your local. See, why do you think estrogen is necessary? See, estrogen maintains even the lubrication of your, all your sex organs. Yeah, I know all those specific hormones like Bartholin's glands, releases it. But for maintaining the normal things, even estrogen is required. So if there is deficiency of estrogen in postmenopausal women, they will have atrophic vaginitis, and see, there is no menses, no. So the normal mechanism to maintain, to prevent infection is lost. So they are more prone for genitourinary infection. Got my point? So they will have, most of the cases you see 50 to 60% is of atrophic vaginitis. So what do you think is treatment? I will say it here itself. Treatment, estrogen gel, because giving supplementation of that will causes other cancers. So that is what I want to say. And also it has to do something with muscle tone. So what is the most common risk factor for prolapse after this thing? So they will have prolapse. See how everything is linked. Why? Because it maintains collagen structure and elasticity, all those things. Something to do with biochemistry. Know the concept, derive it. Then something to do with CVS. See, if a woman needs to be pregnant, her hemodynamic should be stable. For that, she should have a cardioprotective action. Estrogen is a cardioprotective. But later, after 60 years, no use. They have did a trial, they did a cohort, I guess, but no use. Now you know what are the action. This is the physiology. That's why I told physiology governs the menopause. Okay, why this colostrum case I explained, then vasomotor symptoms I explained, then local I explained, then why GUI I explained, why prolapse I explained, why cardioprotective action I explained. Now coming to our, so what happens here? Hormone panel, patho, nothing to do, okay? It's not pathology, it's something morely physiology. If slightly abnormal, HRT, then symptomatic management. So I will not touch more about patho. So basic biochemical investigations to confirm that LH and FSH, all those things. Nothing much would do. Okay. If you are suspecting osteoporosis, then you do DEXA. Okay. Then for that's it. Okay. That is the major things which you should remember. Then again for this thing, I want to talk about statistics also. Okay, fine. Because that is one important thing. Without that, there is no point of studying. Okay, statistics. I'm talking about NHFS 5 criteria. Okay, they say almost 75% of women will have vasomotor symptoms. If she's getting these things, that means hot flushes and that means she is reaching menopause. And almost at 45 to 50 years, mark my words, then 1 in 3 women of postmenopausal age will land up with osteoporosis. If you link this with ortho, you will get a case of Colles fracture. Okay, that's it. Then you will have genitourinary symptoms. In that, you will have atrophic vaginitis and urinary issues. This 10%, then this is 50 to 60%. So these are the major things you should know. See, this is that important topic. You will have your relative, they will come, or you will have someone, you will ask, these are the problems which are facing, which is normal, abnormal, what you need to do. So menopause, I would like to finish in one video itself. Okay, so this is something not even a primary healthcare graduate, even basic person should say this one. So you cannot miss on this topic. Make sure you know it. So again, yeah, if it's a case of treatment also, I will do it here. Atrophic vaginitis, as I told, vaginal estrogen creams will give. So severe, then you go for estrogen therapy. That means hormone replacement therapy. See, you have specific indication for hormone replacement therapy. If you have did a surgical, you know, if she has attained surgical menopause, that means you have cut off the ovary, uterus, and all. So again, she will have all these symptoms. So till 45 to 50 years, you can give a hormone replacement therapy. Then it's a severe case, all your first line, second line, third line are failing. Then for osteoporosis also you can think of. Yeah, but problem is there are a lot of contraindications, man. There is increased chance of breast cancer. Than these things, you have DVT and stuff which are more common, and which is more worrisome to give HRT. Okay. So again, here you can start on vaginal these things, estrogen creams. In osteoporosis, treat the cause. Give a advice is important. You do normal exercise, all those things. Then you can start on bisphosphonate. Then alendronate. Then I'm not sure about the use of teriparatide, that is parathyroid. Then you can think of HRT. This I think you need to discuss. Then for vasomotor symptoms, see, when do you treat a patient? If any disease, if it's interfering with their day-to-day activities, then you start. So here first you start them on SSRI, okay, selective serotonin reuptake inhibitors. Then almost many of them will improve with this. If not, then you can think of HRT. Think of. Okay. Basically here, that hunchbacked woman, all those things, that is something to do with osteoporosis. Basically here the DEXA of lumbar vertebra is something which is very useful, and that's something which you do. So that's it about menopause. I think I have covered major things which you should know as a basic first year, second year student also. Menopause is something which is very important and which patient comes about with. And also as per your advice, so you should know what is the basic things which are dealing with. We discussed about the 25% thing. Then when do you say it's a menopause? Then add physiopatho. Patho is nothing but physio carries the paramount significance here. How estrogen acts on various other organs. That's something which we discussed. And why osteoblast, why blood vessels, why local, and why serious is something which we discussed. Based on that, we extrapolated even the treatment part of it in this part. The treatment also I have did. And also about statistics is something which you should know, because this is what you see. Your brain knows what you see, correct? And basic investigations based on what is the problem you do. Then basic treatment is also, again, if she is coming with vasomotor, try to control, then SSRI, then HRT, osteoporosis, first bisphosphonate, then alendronate, then HRT, then genitourinary with local things you can do. If it's a prolapse, then you need to do a surgery. Got it? That is 1% of the case. So this is the gist of your whole menopause. So if you know, you know.